Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. On this episode, I have a mother, a senior colleague, a global leader who I'm very happy to bring on board. She's someone who I've looked forward to working with if I was in Nigeria. And I'm optimistic anyone in Nigeria who has worked with her has benefited greatly. If I was in Nigeria, I would have worked with her not just in cancer, but in advocacy and impacting the younger generation of women, which she's doing. Please join me to welcome Dr. Zainab Shinkafi-Bagudu. Welcome, Ma. Welcome, Madam President.
It's president-elect. Every Nigerian calls me president.
Welcome, Madam President-elect. I'm going to get used to the elect.
It's an honor and a pleasure to be on this podcast with you, and I hope that it makes the impact that you desire. I want to correct something you said about if you had been in Nigeria, you'd have been working with me. I don't think that's true. I think that already we work together wherever you are. We have had several missions that we have achieved together, many of which we won't even talk about here, but they're all for good and progress for patients, not just in Nigeria, but across low middle income countries. So well done on the excellent work that you're doing and flying the flag as well for Nigerians in diaspora. We're proud of you.
Thank you so much, Dr. Bagudu. Let me not try to, one of the ways Dr. Bagudu has impacted my life is paying for my first membership at the Women in Healthcare Network, which exposed me to the expertise of many Nigerian women doing great things across the globe.
Fantastic.
Before I'm going to the discussion, let me give our listeners and viewers a biography of Dr. Zainab Shinkafi-Bagudu. She's a distinguished pediatrician and global health leader with a profound commitment to women's health and cancer care. A pioneer in Nigerian healthcare, she established Medicaid Radio-Diagnostics and Clinics, the first comprehensive diagnostic center in Abuja, addressing a critical gap in medical services. Recognizing the urgent need for cancer care, she also founded the Medicaid Cancer Foundation, driving awareness, prevention, and improved access to treatment. The foundation has raised over $2 million to address gaps in cancer care. As the former First Lady of Kebbi State, Dr. Bagudu leveraged her position to spearhead transformative healthcare initiatives, including the development of a comprehensive cancer control plan and expansion of HPV vaccination for girls. Advocacy extends globally through our roles with UICC and First Ladies Against Cancer. Dr. Bagudu is UICC President-elect 2024 to 2026 with a relentless dedication to improving lives. Dr. Bagudu continues to be a driving force in the action against cancer, empowering communities and shaping healthcare policies in Nigeria and beyond. Before we dive into the question, Dr. Bagudu, normally we look at what are people saying about cervical cancer. And this time around, I'm not biased. I know you are doing a lot of work on cervical cancer, and a lot of your work is on Twitter. So I'm not biased. I didn't go to get your work from Twitter. I got what other people are saying. First is the woman history is trying to forget. In 1951, by U10, he said in 1951, a poor Black tobacco farmer named Henrietta Lacks went to Johns Hopkins Hospital in Baltimore for cervical cancer treatment. She never imagined her cells would change medicine forever. For him, they were trying to erase her from history. The second tweet was from the Reddit Journal of Science. A new analysis estimates 81,300 cancer cases in 2022 were linked to HIV, mostly in Africa. Cervical cancer, Kaposi sarcoma, and lymphoma made up most of the burden. The last tweet is from Dionandan. He said, countries on track to eliminate cervical cancer. Australia 2028, Sweden 2027, Rwanda 2030, UK 2040, Indonesia 2030, Bhutan 2030, El Salvador by 2030, Canada by 2040. How through HPV vaccine? Same one RFK Jr. is trying to ban. You will note USA is not on the list. There's a lot of discussion going on now about cervical cancer in the United States and the elimination of vaccines, not just even the HPV vaccine. So, Dr. Bagudu, I've admired you for a very long time. I would like to know what ignited your interest in cancer treatment. Why cancer as a pediatrician?
Okay, thank you very much, Doctor, for that information and background. I want to state before I answer your question that Henrietta Lacks, yes, was the woman whose cells paved the way for most of what we know about cervical cancer today. Finally, she was recognized, I think it was just last year, she had the immortal cells, and she was recognized properly by Dr. Tedros for her contribution. So that I think inequity and injustice has been somehow right. We now have at least some recognition for the members of her family that remained. My interest in cancer grew. When I left medical school, I knew without a doubt that I wanted to specialize in pediatrics. And I finished my specialization without even having any serious interest in cancer beyond what affected the children and a few postings on wards that had some genetic component. But when I came back to Nigeria and was working as a pediatrician in a part of the country, northern Nigeria, where the primary caregiver of the family is the mother, and it is the mother that brings the children to the hospital. So I started to, and you know how we are in LMICs. A doctor is a doctor. They're not concerned about your specialty. So a mother might bring her child to the hospital, to the clinic to see a doctor, but she also has a funny discharge or a swelling in her breast or a lump somewhere. And she will ask me, especially because I was a female. And I slowly realized that a lot of women were poorly educated about their own health and bodies. And that was how it grew. We started by having awareness sessions for women, strictly women, open evening tea, coffee, and we will put some education in it. And then the foundation was born, the Medicaid Cancer Foundation. And from there, we continue to work with the needs of these women, especially as it had to do with breast cancer, which was the commonest complaint or question I was getting. I'm not sure today in 2025 if that would have been the same course and journey that I would take in my life. Why? Because of the fantastic work that a lot of people, government, non-government actors, state actors, civil society in particular are doing, many people are much more aware of cancer now. So the simple answer to your question is, I was struck by the lack of knowledge that existed in the space, and I started doing something about it. And the foundation grew from creating awareness to providing screening to raising funds. The women find things or they find different issues and they have to go for screening or they have to go for treatment and they simply can't afford it. So we have to raise funds through various mechanisms. And then you again realize that, oh, your mechanisms are not good enough. We need governmental involvement. We need policies that will be better, that will make it easier for us to have access to medicines, access to radiotherapy, importation. How do we remove, how do we get some, generic drugs into the country and stuff like that? So government influencing a high level advocacy. And that's how we have been going along the entire spectrum of cancer care.
Thank you so much, Dr. Bagudu, for sharing your beautiful story behind oncology and choosing oncology as a career of choice. There are NGOs starting across the world, and one of such aspects they might want to do by focusing on health is cancer. What advice do you have for anyone starting an NGO in cancer management globally?
Again, I'll answer that question very broadly because I interact with a lot of young people, and young people have passion, they have interest, and they pursue various courses. And I find that one of the flaws or one of the basic things that is missing from such zeal is organization. So when you want to go into any advocacy, you have a passion and you have an interest in a topic, it's important that you get your structure right. Yes, now more and more we're having people that are aware or that they know that they should register their companies, but it goes beyond that. You need to have organizational structure, and then you need to have institutional memory. So it's very important not to just start an NGO and then you write letters to people. You have this fancy idea. I want to have an activity. I want to screen 10,000 women, but you don't know where the money is coming from. So they write to people and ask for money. Fine, you get the money. And then what? Next week, are you going to come back to the same, or next month, will you go back to the same people and ask for money? So you need to, and then they don't record it properly. It's getting better, but recording your achievements, having clear work plans, and going step by step. For cancer, I always say, unfortunately, a lot of funding is not available for non-governmental organizations that are mostly active in the awareness prevention stages. We do things more around awareness, activities that has to do with sensitization, some capacity building. But when it comes to treatment, it's very difficult for cancer NGOs to be involved because it's so expensive, especially in the global south. So the global funding that is available for cancer is mostly in the research end of the spectrum. Some treatment, again, is available, but I don't think you've ever heard of any fund that maybe when the NIH was more active, but it's linked to institutions, is linked to some sort of research and data collection. You will not, it's very difficult to hear of NIH sending funds like USAID would, or medication for HIV like we had under the PEPFAR fund for cancer. Having said that, there is a strong global effort now to institute what we hope will be a global cancer fund, and I've been attending several discussions on that topic. So starting an NGO, get your structure right, have a clear work plan, go with the law of wherever you're operating from, and have your goals clearly defined and how you're going to get there. Once you have institutional records, memory, data, in this 2025, this age of data, you must have very strong data. That way you can access different grants and funds. And even for the philanthropic donors, it's much easier when you approach them with a history and a record of what you have been able to do.
Thank you so much, Your Excellence, for highlighting the must haves for building an NGO anywhere in the globe, especially on cancer care. Cervical cancer is now largely a disease of inequity from your paper. Please, can you shed more light on this?
Well, what we mean is that if you look at countries in the global south, the along the spectrum of cancer, prevention, which we achieve through vaccination, treatments, and then the other end where the mortality comes. If you look at all those indices, the statistics in the global south, countries that are in the global south, are not equitable to what we see in the north. The numbers that have been vaccinated is much lower. The numbers of women that are able to access treatment, again, is much lower. But when you look at the mortality, how many women die from cervical cancer each year is very high. And then if we reverse a little bit and look at the data, you'll find that the data is skewed. A lot is not captured properly. They're not captured because they're not accessing a medical center. So in Nigeria, the figure for cervical cancer is 12,000 women develop cervical cancer every year, out of which 8,000 die. Now, I don't want to sound, but I'm sure if I made an effort, I on my own could pick 12,000 women in a year because it is that high. But these women are not being recorded. Many of them are they're not captured. Unlike in the north, where in places like the United States, cervical cancer carries a 95% cure rate, the incidence is so much lower because there's been vaccination. You listed a few countries that are on the way to eliminating the cancer. So that inequity that we find is really what we're trying to close the gap on.
Thank you for educating us, Your Excellency. You are a top voice on cancer care globally, and you've collaborated with stakeholders in the global north and south. What has been your biggest challenge as a global cancer advocacy voice from Nigeria?
Okay, I'll answer that question from two aspects, from the global aspect and from the Nigerian aspect. From a global aspect, I think that I have received a lot of support and listening ear because people want to hear our story. My colleagues that are working in high-income countries, they want to understand how we are coping, how we do things, and so on. Read more about our outcomes, access to research and what we do. And there are not many people that are in the space from our end of the world. So in the high-income countries, I can have a lot, I would say I have received a lot of support and support for my work. In Nigeria, the same is true. However, cancer tends to be at the bottom of the list of priorities for Nigerians and other low-income countries, I'd say. Because, I've been a first lady in a state where people, they look to my face and tell me things like, look, we're hungry. Why are you talking about cancer? Cancer is a human disease, So that is one of the aspects that has been difficult to overcome. But by and large, I'm happy and very humble to say that today, there's hardly any conversation or anyone I want to engage when it comes to my work that I don't have access to or will not give me a listening ear. And I say this, I mean this by, I mean the young boy in the village that is playing football right up to the corridors of power, the presidency, and foreign partners, and so on. So it means that we've done something right as a group all together. Collectively, we have been able to amplify the issues that we face in cancer. And one thing about us is that when you stick to something and you sustain it, then it shows that you're serious about it, and people have begun to look at it like that, okay, she has come with this cancer again. Let's listen to her and hear what she has. So, and then you can lay your points if you're able to put it in a way that resonates with the leadership, then you can get things done. So happily, I'm able to, I'm in that position now, but it took years of working together with so many other actors.
Thank you so much, Your Excellency. From the paper, I got that since WHO announced the elimination targets in 2020, what are the elimination targets from the paper?
Okay, so basically, elimination targets are it's a work plan, a global strategy, which WHO announced, and it's proven, and it was based on research to eliminate this cancer. It targets the HPV virus, which is the cause of 95% of cervical cancer, and basically is the 90-70-90 plan. It states that if we vaccinate 90% of eligible girls aged between 9 and 14, if we screen 70% of women at least once in their lifetimes from the ages of 45, and we treat 90% of early lesions. You have to understand the pathology and progress of cervical cancer to understand what's behind these targets. By screening, you can pick up precancerous lesions, that is, lesions in the cervix that have not developed into cancer yet. And there are very easy treatment tools that can be used in an outpatient, even in an outreach situation, to get rid of those lesions. So by using things like cryotherapy, we can treat them and the woman will not develop that cancer. But if you leave it in some years, it will develop into cancer. So those countries that you mentioned have been able to achieve this. They have vaccinated a huge proportion of their girls. They are screening their women regularly. Every woman, at least once in her lifetime above the age of 45, is getting screened. And if you see any lesion, you treat it. You treat it immediately. For us in Nigeria, and many other that we've mentioned have gone through those steps, and they're reaching those cutoff points. 90% of girls, almost not 90, Rwanda, you said 2028, 90% of girls, almost 90% have been vaccinated. So that by, actually, you know what? Rwanda has passed 90%. It's on record, but they're behind in screening, and they have this agenda 2027 that by 2027, they're going to be able to reach those targets. And then for the treatment, so that's how it is, most countries. For us in Nigeria, we just started the vaccination last year, but it's good that we started. At least we're catching up now. And since the resumption of the vaccination, we've been able to vaccinate about 13 million girls, which is not bad.
Wow.
Especially when you consider that before Nigeria, only 6 million girls, boys and girls across the entire continent were vaccinated. So we came in with that, and we're doing well. The National Primary Healthcare Development Agency, that's the government agency that is in charge of vaccination, is making sure that the vaccine is available for people to get. Of course, you face different hurdles, which is maybe answers another question you asked earlier: misconceptions, misinformation, rumor mongering, and addressing how to change the mindset of not just the ordinary families, parents, and the girls, but even our healthcare workers. Some of them do not really understand or believe in the principles of vaccination, and so that creates extra work. Even in the Western world, you do have the anti-vaccine campaign, which is high. And we actually found that a lot of the material that comes into Nigeria is coming from the West. It's not here that our people sit and create it. They send those videos and then we circulate it. Unfortunately, it has a much more lethal effects, because we we go into so much effort to educate, and one simple video can just wipe out thousands of would-be people that have been vaccinated.
Exactly. Exactly. Thank you so much, Your Excellency, for that elaborate explanation. I want you to tell us 3 things people should know about HPV vaccination in Nigeria. I know you are doing a lot of advocacy, but what are 3 things you want us to know about HPV vaccination in Nigeria?
Well, HPV vaccination is safe. It is not, I'll just do the vaccination as one package. It's safe. It does not cause infertility. People shy away from saying that, and I've been told sometimes not to. But I think we have to say it because they're saying with full chest that it causes infertility. So if people like myself don't say it doesn't cause infertility, who will say it? So we need to say it very clearly that it does not cause infertility. So many people have had HPV vaccination, and they have gone on to have children. There's nothing they didn't say about the COVID vaccine, but we're all alive today. We're all going to drop dead after blah, 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 but we're still alive. So HPV vaccination is one of the elimination pillars for ending not just cervical cancer, but other cancers that affect men. Because of the patriarchal nature of our society, when you let them realize that, look, this is a sexually transmitted virus, and it is a virus that attacks the cervix as well as all that area. So the penis you can get penile cancer caused by HPV vaccine. Oral cancer can also be caused, and anal cancer by HPV virus, not vaccine, by the virus. So penile, cervical, anal, oral cancers can be caused by HPV, a human papilloma virus. So we must appreciate the fact that it's not only women that get this virus, men get it too. And finally, it is the most cost-effective way. If we vaccinate and we are protected from developing the disease later on in life, it saves us trillions in costs for later on from that we would have otherwise had to spend on treating cancer. There are very clear economic case studies for this. I don't want to go into it because it varies from place to place, but this economic advantages and savings that we make is in trillions when we prevent as opposed to treating cervical cancer. So HPV vaccination is the most effective way. It's about 20 years now, coming up to just 20 years. And the countries that have been doing it are showing more and more increasing record, and data is showing that it works and it does what it's supposed to do.
Thank you for sharing those solid points with us, Your Excellency. I would like to know, where do you see low and middle income countries, especially Nigeria, in a decade with regards to cancer management? I know we are growing, thanks God for global icons like you among us that's improving our cancer management as a country. Where do you see us in a decade?
We're going to be a lot better off than we are, but unfortunately, the incidence is going to keep rising. And so in a decade, we'll find that all the cancers, breast and cervical, prostate in the men, which is the commonest, would have increased. And population is also increasing. So unfortunately, unless we double up on our efforts to provide prevention and treatment facilities, where it's going to be quite a tough one. Cancer is expensive to treat and to even prevent. So these are the issues that have been affecting government. Yes, we now have more screening centers. The coordinating Minister of Health, Professor Patti, announced 6 more centers, and we've seen at least 2 of them open with radiotherapy machines and so on. But it's not enough. We still have to have better coverage under our National Health Insurance Scheme for people. If the cancer centers are there and if you're asking a woman from the village to pay 1.2 million naira for a round of chemotherapy, it's tough. That's almost $1,000, just under. So it's tough. She might have to spend $1,000 just to get to the hospital, logistics of transportation, and carer, and so on. So I think that we're doing well. The needle is moving. 10 years time, we need to multiply our efforts 10 times if we're going to see a reversal of what's the way the graph is currently going.
Thank you so much for that, Dr. Bagudu. Actually, thank you for honoring the invite and sharing your knowledge with us. It looks simple because you are the one speaking. It's your area. You are the expert here. Global citizens, Dr. Bagudu has elaborate work on, if you don't know, in case you don't know, she has elaborate work on cancer management, not just in Nigeria, but globally. So you should read the paper we are speaking on in question, go across all our work and try to share it with colleagues, discuss with colleagues, because as you are discussing with colleagues, it's also advocacy. It's not just watching this video and getting the knowledge. Share with people, it sticks to your brain, and also you help not just yourself, your families and societies. Thank you once again for coming, joining me on this platform, Dr. Bagudu.
Thank you. Thank you so much, Doctor. Thank you for having me.
Nice week, everyone.